Welcome to Expressions of Leadership. I'm your host, Michele Kawamoto Perry. In every episode, we explore how people from educators and artists to executives and entrepreneurs lead with authenticity, rise through adversity, and share the wisdom they've gained along the way. Today's guest is a strategist, innovator, entrepreneur, and healthcare reform advocate who has spent more than 25 years building organizations across industries. From serving as a nuclear submarine officer in the U.S. Navy to founding consulting firms, nonprofits, and the virtual healthcare company Amaze Health, David Silverstein has devoted his career to solving complex problems. He was also a driving force behind the federal transparency rules, which now require hospitals and health plans to publish pricing information, bringing clarity to a system that has long been confusing for patients. David, welcome to Expressions of Leadership. We really appreciate you being here.
Michele, thanks for having me. You started out really good for my ego with all of that, so I'm looking forward to this.
So, David, you began your career as a nuclear submarine officer in the Navy. What did that experience teach you about leadership at a young age?
I think, first of all, put those two things together, leadership at a young age. Where else does anybody have an opportunity to lead at a young age, right? One of the things that always stands out to me in my mind is by the time I was 25 years old, the Navy had me running a nuclear power plant. My civilian counterpart was probably 50 or 55 years old, right? So somewhere somebody thinks you need 25 years of experience to run a nuclear power plant, but the Navy taught me how to do it by the time I was 25 years old. So just the responsibility, the immense responsibility that you get and learn to deal with at such a young age, I think starts developing that leadership capability in a way that in other industries, we make people wait 10, 15, and 20 years even to get on any kind of a leadership path, even to find out if they've got it inside of them. So for me, it was just an opportunity to kind of discover myself, if you will, probably a lot earlier and faster than I would have anywhere else.
And how did the discipline and decision-making that was required in that environment shape the leader that you are today?
I think in the military in general, but certainly on a nuclear power submarine, everything is about rigorous process and adherence to process and complex problem solving, right? The Navy had to turn me into a nuclear engineer, an electrical engineer, a mechanical engineer, a chemical engineer to run a nuclear power plant and then ultimately an entire submarine. And so, very, deep learning, the ability to, draw upon all of that knowledge to solve problems, and to, work with a team of, people to do that in real time. It's just opportunities you just don't get anywhere else. And I think that really shaped, my career went in the direction of operations, process engineering, process design, operational excellence. And I think that really all started with being on a submarine because it was such a process and operations driven kind of environment.
And when you transition from the military into the private sector, what leadership lessons carried over and what really had to change?
The first job I had when I got out of the Navy, I remember sitting down with the owner and the CEO of the firm. It was a nice sized firm, about 100, 120 or so people. And he said to me, David, I think you're really the right guy for this job. I was kind of the first professional manager that the company had hired for its operations. And he said, I really think you're the right guy for the job, but just I'm a little bit worried that coming from the military background, you're going to expect that there's a manual for everything. Everything's written down and there's a process for everything. And, it's not really like that in the private sector. And I sort of laughed at him a little bit and said, it's not really like that. There's a process for everything and there's a manual. But at the core of our training is, you're on a submarine, you're training for combat, right? You're training for war. You're training to be able to problem solve when things are going wrong, right? When somebody's shooting torpedoes at you, when somebody's trying to blast you out of the water, and pipes are leaking, and your nuclear power plant is scramming, and so I said, don't worry about it. I'll be just fine with the fact that there's not, a book for everything. Solving problems and figuring things out is really what you train to do in the service. You don't train to follow orders and just to follow a process all day long.
And then you've worked in operations and for some large companies such as Seagate Technology. And you did that before you launched your own ventures. At what point did you realize that you were more drawn to building organizations than working for them?
I think when I was getting ready to leave the Navy, which was a tough decision, I came this close to making a full career out of the Navy, but it was the mid 1990s. The Cold War was over. I was pre 9/11, so there wasn't really a mission for the submarine force in the mid 90s. The U.S. was in the process of going from 120 submarines down to 60, right? Because what were we going to do with them? Until 9/11, there was nothing to do. So, I couldn't see, having children and going to sea for 6 months at a time, during peacetime. Wartime, you do whatever you have to do. So, when I started thinking about leaving the Navy, I think I got in my head all the way back then that I'd like to have my own business. But I've always been wary of people who start businesses because they want to have a business. Um, that's the metaphorical chef who wants to own his own restaurant, right? But has no capability to run a restaurant. We see it every day, the restaurants that people open and go out of business within 2 years. So I always had it in the back of my mind. And when I was at Seagate Technology, an opportunity just presented itself. And when it did, I decided, hey, this is the time. I need to do this now. In fact, we were living in Singapore at the time and had only been there 10 or 11 months when I said to my wife, hey, that business thing back in the US that I'm been talking about? And she said, yeah. I said, it's really happening. We're going to have to leave and go back to the US. Now, mind you, my wife didn't really want to go to Singapore in the first place, but once we got there, she loved it. So now we're there 10 months. She said, well, but I thought we were going to be here 3 years. And it was now or never. The opportunity was presenting itself. The first customers were there. Do it now or probably never get a chance again. So I think it's something I was always looking for, but I just got lucky and the right opportunity came along.
And so you founded Breakthrough Management Group, and that was in 1999. What was the leadership challenge that stretched you the most during those early entrepreneurial years?
I think, at the time I started the business along with a couple of consultants that Seagate Technology was using at the time that I was working with. And so I was very familiar with the field of consulting that we were getting into when we started Breakthrough Management Group. And the one thing I saw that every little consultancy struggled with is how do you build a business, deliver your services, and go find your next customer at the same time? So I think a lot of people go into some kind of services or consulting type of business. You might be an accountant or a management consultant like we were, and you get your first customers, and that's very exciting. You got money coming in, you're making good money, but you're doing the work for your customer. Somebody's got to be finding the next customer at the same time. So it was really balancing that, being the subject matter expert, being the consultant that the client was paying to come and do the work for them, and having to figure out how to actually build a business, drive sales. How do we do that at the same time? And so I think that's why so many, as we call them, 2 men in a pickup truck, right? So many little firms never get beyond the first 2 or 3 people because they don't figure out how they're going to do both of those things at the same time.
And looking back, what mistakes or missteps taught you the most about how to lead people and organizations?
Got a lot of mistakes. I think, especially when you're young, to me, you got to go through a lot of cycles of things before you start to learn certain leadership lessons. You start to see people getting burnt out. And in the business we were in back then, everything was travel, right? People would get on airplanes on Sunday night, they'd be flying home Friday night, right? So long, long weeks, and figuring out how to not burn people out, how to we built a unique business in the kind of boutique consulting space we're in, where we actually hired people. Most companies would build their workforce around independent contractors, right? Because they didn't want to have to pay them when they didn't have a client, right? And we said, no, we're gonna hire people, and we're not going to put them out there with clients 240 days a year. Or maybe it's going to be 180. It's still a lot, but it's not going to be 240 or 250 working days a year. And so we created what I called a highly leveraged workforce, where people were involved in the sales process, involved in intellectual property development, involved in we published a book on innovation. We had 25 people contributing to writing the book and researching for the book. And so, creating something that gives people some diverse things to do, keeps them stimulated, not just treating people like machines doing the same thing over and over and over again because it pays, but really figuring out how to make the company work for them also, I think was, probably the biggest challenge, but also one of the real keys to our early success.
And many of the roles that you've had have centered around strategy and process improvement. How do you balance that kind of analytical thinking with the human side of leadership?
First of all, I think there's this myth that people fall into one bucket or another, right? You're very technical, analytical types aren't very personable. For example, don't have the soft skills, don't have the people skills, and it's just not true. And so we tend to bucketize people. The other thing, one of the biggest things I took away from my time in the Navy was, I mentioned the Navy, turned me into a nuclear engineer in a matter of a couple of years, right? Just learning how to learn and translating that to other people. My expectations of people learning is very, very high. My expectations of what they know when they come to my company isn't all that high at all. I don't really care that much, right? Because I know people are capable of learning a lot more and a lot faster than they give themselves credit for, because they've never been put through a regimen where they had to learn a lot as adults. And people actually really enjoy learning. So, so really understanding people, again, it's the same kind of thing, stimulating them, helping people learn. And a lot of what they were learning was those analytical skills, the thinking and problem solving skills. But in that business, everybody was also a teacher. We would call ourselves management consultants, but really what the business was all about was going out to companies and teaching and coaching and leading them through the development of strategy themselves, leading them through the process of solving problems themselves. So everybody had to become a real people person and not just an analyst, not just a technical problem solver, because teaching and coaching was how they practiced their craft, if you will.
It's really relationship building skills.
Yeah, absolutely.
Well, let's take a quick break. Up next, David and I will talk about how his work shifted from consulting and operations into healthcare reform and what drew him into tackling such a complex system. Stay with us. Leadership isn't just about strategy, it's about people. The Forward Project helps organizations cultivate strong, adaptable leaders who create thriving workplace cultures. If you're ready to invest in your leadership team, visit www.theforwardproject.co to learn how. Welcome back to Expressions of Leadership. I'm your host, Michele Kawamoto Perry, and today we're speaking with David Silverstein, founder and CEO of Amaze Health, about leadership innovation and transforming healthcare. Now, David, you've described the U.S. healthcare system as deeply broken. What first opened your eyes to that reality?
So I think anybody that's grown up in the U.S. has a little bit of a sense of it, but it's a really, really complicated system. The US healthcare system is pushing this year a $5.5 trillion ecosystem. That makes it the third largest economy on the planet. You've got the economy of the United States, you've got the economy of China, and then in third place, bigger than Japan, bigger than the UK, bigger than Germany, is the US healthcare system. So if you think about that, anybody that says they understand healthcare is lying to you, right? That would be like saying, I understand everything about the economy of Japan, right? Obviously, a ridiculous notion. So it's an incredibly complicated system. My management consulting firm got lucky back in 2000. We took on a hospital system as a client in Columbus, Ohio. And from that point forward, 10 to 20% of the business in any given year was always healthcare. So large insurance companies, United was a client at one point, Cigna was a client, Kaiser, large hospital systems in big metropolitan areas around the country. So had my hands in healthcare through, for the non-healthcare folks, what we generally call the payers and providers, the providers being the hospitals, the doctors, the medical facilities, the payers being the insurance companies or the government in many cases. So had my hands in that side of healthcare for many years. So I understood the system, but it wasn't until probably a dozen or so years ago that I started really looking at the system closely through the lens of patients. So think of the three Ps: payers, providers, patients. I usually paint that picture as a triangle and just put it upside down with payers and providers at the top and the patient at the bottom, right? Just to sort of make the point that we need to flip that triangle back and put that patient on top. But I got angry at the system and what I saw it doing to people. Started with a medical bill that wasn't a big deal to me, but my 15-year-old daughter, so I guess 15 years ago now, because she's 30, my 15-year-old daughter was peppering me with questions about this emergency room bill that was a result of her getting a concussion, playing basketball. And as she's asking me questions and I'm trying to answer her questions about the bill, she's looking at me like I've got two heads, right? So my own kid is a bright kid, and she's looking at me like, Dad, none of that can be true. That can't possibly be true. And as I started explaining to her the bill and, why does it say $11,000, but we really only have to worry about $1,000 of it? And then she says, does anybody have to pay the $11,000? And I said, well, actually, if we didn't have insurance, yeah, the hospital would be. And she's looking at me like I got four heads now, right? And so I said, you know what? Instead of just answering your questions and paying the bill, I said, why don't we write a letter and ask your questions of the hospital? So the first letter we sent said, would you please send us your price list? Right? And it seems like a pretty simple question. I knew the answer that I'd get, but I didn't know I'd get in writing a letter back that says, we're sorry, we can't give you our price list. Our prices are proprietary. Right? They literally put that in writing. And the letter is signed by somebody with the title of Revenue Enhancement Specialist. Like, in what industry, like, take as much money away from customers as possible specialist. So anyway, we had some fun. We went back and forth with the hospital a few times, finally paid the bill. And then I kind of regretted paying the bill. I said, I would have liked to take that a lot further. I sent a couple more letters to the hospital, crickets, because if you don't owe the money, they don't owe you answers, right? So I have four kids, but I had to wait for that kid to go to college a few years later and find her way to the emergency room 3 times her freshman year in college. And so now I had bills again, and I could start, fresh and really start going a lot deeper and, intentionally created some real battles with hospitals. And that's what led me to creating a nonprofit to help other people deal with their crazy bills. And that's how I sort of got sucked into the rest of healthcare.
And so you spent quite some time trying to drive change through public policy. What did that experience teach you about how change actually happens?
The thing about healthcare is I found so few people actually understand healthcare and the system of healthcare that we have in this country. Experts in healthcare don't understand healthcare. The number of government officials, smart people, White House economists that I found that just didn't really understand the way the economics of healthcare were really working. Um, that kind of floored me. And then, the whole legislative process. It's at the state level, it is such an unsophisticated game, it's almost scary. You got legislators proposing legislation that they don't understand anything about, right? They've got a constituent. And here in Colorado, each legislator gets to submit 5 bills. They're going to submit 5 bills each year. If they're the party in control, they can submit as many bills as they want. And half the time, they don't understand 95% of what's in their bills. They're relying on somebody else. And that somebody else may have a passion for something, but they don't really understand it. I've seen so many well-intentioned bad bills, and in a lot of cases, they literally make things worse, right? Because we keep slapping band-aids on a broken economic system. Like if you don't fix the economic foundation, then every time you layer a band-aid on top of something, there's just somebody's going to take advantage of it, right? And the US healthcare system is just literally a completely dysfunctional economic model. I used to say that to people, and I'd get eye rolls. They'd say, "Yeah, yeah, yeah." And I'm not an economist, but I'd start walking people through the economic principles that are just absent from the system. I mean, if you went to ChatGPT and you asked, "What are the basic requirements of a functioning economic system?" One of them you're going to get is an effective system of price discovery, right? Sounds like a very technical term, price discovery. All price discovery means is two parties to a transaction have to somehow agree on a price before they can transact. There's lots of ways you can do it. You can do it through a bidding process. You can do it through negotiation. You can do it through transparent pricing. But you got to have some way to agree on a price before the transaction. In healthcare, we don't do that. In healthcare, we find out the price after the transaction, right? So right from the get-go, it is a completely dysfunctional economic model where supply and demand signals don't work. And we can keep trying to layer band-aids on top of that system, but until we fix the foundation of the system, nothing's going to work. I hear people talk all the time about greed, and healthcare is capitalism run amok, right? And it's the opposite. It's a system where we've shut down capitalism, right? So none of the forces of a market economy are working in our healthcare system. Greed is actually a good thing in a functioning economic system. It drives innovation. It drives people to be aggressive, to get efficient. They want to make more money. They're greedy. That's what capitalism is all about. And when you kind of shut down those forces, then you get this really, really broken system. So that's what really drew me into healthcare is that realization that we got to fix a $5 trillion economic model here.
And in fact, you became so passionate about this that you ended up being the driving force behind the Transparency Act, which mandates that hospitals and insurers disclose pricing for services to consumers. What did it take from a leadership perspective to push something like that forward?
Yeah, so it took a lot of stupidity. So my daughter, summer before she went off to college, I think it was that summer, maybe a year before, I said, let's find us a legislator I want to write a bill. And so I basically paid her to be an intern for me for the summer. And she actually got us a meeting with our state representative. And we sat down with him and told him what we were working on. A really smart guy, an attorney by background, and he said, "Yeah, I'll sponsor this bill." So we wrote a bill. It was the first bill anywhere in the country that had any teeth to it. That was, the language was going to be very effective. People told me we'd never get. So he was a Democrat. People said, well, you'll never get Republicans on board with this. We got Republicans on board. They said, you'll certainly never get libertarians on board. We got libertarians on board. We called it a tripartisan bill. Who can disagree with the idea that we need real transparent pricing in healthcare? The healthcare industry, you know, business minded in this particular space expects Republicans to do their bidding. So they were going to Republicans to shut down the bill. And to his credit, the then senior Republican in Colorado, I think he was Speaker of the House at the time, he stood his ground. He basically told the big lobbies, hey, once a year, I'm going to eat one bullet, and this is the one. We're not giving this up. So we started with Democrats, and then it was Republicans that took so for Democrats, it was consumer protection. And for Republicans, it was more, pro-business. We've got to drive down the cost of healthcare for business. For libertarians, it was this is just good free market principles, right? So we got them all on board. We were going into a committee hearing. We had, kind of a straw poll. We were going to have a unanimous vote in committee. And then about 36 hours before the vote, the big guns came out. My understanding from a U.S. senator is $6 million was dropped into some PACs, who were told to kill this bill. I had Democrats calling me a day afterwards, apologizing after they voted it down. Really, really the ugliest politics you can imagine, but so ugly that the story made its way to Washington, right? And how it got killed made its way to Washington. And that really got the attention of some people who read it much more closely. A U.S. senator wrote a piece for the Wall Street Journal about this legislation. It was actually published about a week after the bill had been killed. So some folks in Washington picked up on what we were trying to do, and that ultimately led somebody to call me and saying, hey, we read your bill. You seem to really understand the mechanics and the nuances of what really needs to be done better than we would. Will you come and help us do this at the federal level? So what did I learn? I learned a lot of things, but maybe the best thing I learned, there's a lot of really good people that want to do really good work. I remember having one meeting with 3 or 4 senators down in the basement level of the Capitol in Washington, and they were completely on board. They smart, understood what we were trying to do, very, very supportive when we were meeting in the basement. An hour later, I see one of them up in the rotunda doing an interview on CNN saying exactly the opposite of what right? And so, what I see is a lot of people really hamstrung by a bad system. A lot of people that really want to do the right thing, that are a lot smarter than we give them credit for, because they have to play the game, right, with their financial supporters and their party. And so I think we got a lot more good people than we think we do, and they're really stuck with a tough system.
And so throughout this experience, you're trying to influence these very large systems, the government and healthcare and even corporate systems. What leadership qualities matter the most when you're trying to do something like that?
Well, I think everybody's got their own style and their own strengths. Mine was not being the guy that everybody liked the most. Mine was being the guy that could articulate to them and really help people understand, the why behind things, put things in terms that people could really, really understand. I remember explaining some basic economic principles using the analogy of buying a head of lettuce in a supermarket. And I remember the administrator of CMS at the time, rolling her eyes and asking other people in the room, what are we doing here? We're talking about a head of lettuce. Like, we're supposed to be talking about healthcare. A week later, she's on national television saying, so imagine you go into a supermarket and you're looking to buy a head of lettuce, right? And so what that tells me is I was able to use that metaphor to explain what was going on in the healthcare system. Um, and it actually had an impact. And, so really, and it was very simple. I mean, I'd ask people, last time you went to the supermarket, how much did you pay for a head of lettuce? Can you tell me? Do you know how much you paid for a head of lettuce the last time you bought a head of lettuce? You don't. I'm sure you don't, right? You don't know if you paid 79 cents or 99 cents or a dollar for it. Like it could be a $2 difference, a $3 difference. There's some point at which you might say, oh, that's kind of expensive, that $6. But you're kind of numb to it. And yet it's a super, super, super competitive market, right? Walmart and Target and Kroger are all competing with each other. They're not going to rip you off by charging $6 for a head of lettuce when the fair price is 79 cents. And so what I was doing was shutting down this absurd notion that, oh, people don't really shop around for healthcare, right? When your kid's bleeding and you have to go to the urgent care or the emergency room, you're not going to really, healthcare is different. Transparent pricing in healthcare isn't going to make a difference. It's an idiotic notion. You don't know what a price of lettuce, a head of lettuce costs because of one simple concept. You trust that Walmart knows what Target is charging, and Target knows what Kroger is charging, right? And they know what Whole Foods is charging. And so you trust that these market forces are at work and you don't have to shop around too much for the price. And so, from a leadership standpoint, I used to get asked, who's your lobbyist? And I'd say, well, I don't have a lobbyist. Well, you need to get a lobbyist if you want to get anything done. And I said, I'm not getting a lobbyist. I need to actually, I'm not lobbying here. I'm explaining. I'm helping people really understand. It's a different approach to things. So even in my own business, my team probably often thinks that Dave talks too much. He's always explaining things to us ad nauseum. But in the end, if you really understand what you're doing and why you're doing it, you're more motivated to do it. It's easier to get things done. So, but I think everybody's got their own style. Some it's influence, and for me, it's taking the intellectual path, if you will.
Well, we're going to take a brief pause, and when we return, we'll hear from David about how his work changing systems at scale led him to build new solutions in the private sector. True transformation starts from within. The Forward Project partners with organizations to create meaningful culture shifts and develop leaders who inspire real change. If your team is ready to move forward with purpose, visit www.theforwardproject.co. You're listening to Expressions of Leadership. I'm Michele Kawamoto Perry, and today's guest is David Silverstein, entrepreneur and founder of Amaze Health. David, after working on policy, you turned your attention to private sector solutions with Amaze Health. What prompted that shift?
I don't think I would call it a shift. I was starting to develop the concepts behind Amaze back when I was doing that public policy work. We need that transparent pricing to create a functional economic foundation of our healthcare system. But I still think it's private companies that are actually going to solve the big problems. They just can't do it if the healthcare economy is not functioning as an economy where innovative companies can thrive. So I started developing the concepts of Amaze 2017, 2018. We started building something in late 2018. At first, it was possibly going to be a line of business for my other company, the management consulting firm. And then as we got deeper into things, I realized we're going to need to build our own medical practice because everything I want to connect to out there is garbage. I saw businesses I didn't think were going to make a difference. And so I decided we're gonna need to build a medical practice also, not connect to other people's medical practices. And so that's when we decided Maze has to become a standalone business. So we started building a technology platform. We introduced things to the market in early 2020. You'd think COVID would be good for a virtual healthcare business. but not if you have no customers the day COVID lockdowns start. If we'd been a year or two earlier, it probably would have been great for us. But I always thought we were going to need private sector solutions to ultimately solve the big problems. We just also need public policy that gives those companies a chance to make a difference.
Now, you've said that Amaze Health is dedicated to providing world-class virtual medical services. What does that mean to you, and how does leadership shape that experience?
Kind of leveraging my experience. So I talked about, BMG and our business model early on being to hire W-2 employees, right? Not just a bunch of independent contractors. Most virtual medical services are, they just stitch things together. They're a call center or a technology platform, and medical providers or independent contractors. Maybe some of them work for the company. Maybe the company is just connecting patients with providers, and it's just taking transactional medicine and moving it online, right? So we decided very early on that all of our medical providers were going to be W-2 employees. They were going to work for us, and they were going to really own a relationship with their patient. One of our core tenets is that we treat every patient as a patient for life. Most of our customers are employers. Virtual healthcare companies that go into employers assume that their customer is only going to be a patient while they work for that company. And we said, well, that doesn't make any sense. Why would anybody adopt you as their mental health partner or their virtual primary care provider if they thought they were going to lose access to you when they change companies or jobs in 3 years or get laid off, right? So from the very start, we said, we're going to build relationships with patients. We're going to have a long-term perspective, and we're going to give ourselves an incentive to solve their problems, not to schedule the next appointment, right? And if we do a good job of solving their medical problems and building a relationship, they're going to want to pay us every month for the rest of their life to be their medical partner, to be there for them no matter what happens. And we have to really believe that and have confidence in that, and not build a model that's based on making money by scheduling the next appointment. I think this is most prevalent in mental health. I don't think we actually have a shortage of mental health providers in this country, right? There's not a lot of things that I'll tell you that probably sound contrarian. I'm a big contrarian on this. I think we have a super misallocation of mental health resources. I think people go and see the same therapist every week or every month, month after month after month, in many cases for years, which ought to tell us right there, their problem's not getting solved, right? And mental health is almost by definition a recurring revenue model. You only make money if you're scheduling the next appointment. That's not the fault of your therapists and your counselors and your psychiatrists. That's the system that they work in, right? We're trying to change the system. So we want to actually get you to solution. We want to give you the personal skills to deal with life yourself. And we want to do that in a way that leads you to wanting to be our customer, even though you're not having to sit on our metaphorical couch next month, right? So we decided we were going to build the system that we all want and believe we should have, and not be constrained by the system that exists today.
And how do you build trust with clients and patients and even employees when you are disrupting a traditional system?
Well, for patients, tell me which part of it you need to be convinced is better. You call us and we answer your call within 15 to 20 seconds. You got any concerns with that? Is that disrupting your model? The person who takes your call 90% of the time is a medical provider, a physician, physician assistant, or nurse practitioner, not a triage nurse, not a call center operator. You're not having any problem with that experience, are you yet? That's not disrupting your apple cart because it's different than when you go to your doctor. They take care of your needs very quickly and work in this very collaborative model. So let's say we needed to send you to an urgent care, even though we'd rather take care of things ourselves if we can. Simultaneously, that you're talking to that nurse practitioner, she's on a screen telling one of our patient advocates to find you that urgent care and to, get that address over into your mobile device. So you can just click a button and have the GPS and go, right? All makes sense. So we've just built the model that every American would like to have, right? We don't have to convince anybody as far as patients go that what we're doing is disruptive. Now, the providers out there, the insurance company, that's a different story. But from a patient standpoint, there's not a lot of convincing we have to do.
Let's take a short break. When we come back, we'll explore the values and principles that guide David's leadership and shape the culture of his organization. Don't go anywhere. By partnering with Expressions of Leadership, you'll reach an audience of professionals passionate about leadership and growth. For sponsorship opportunities, please contact us at letstalk@expressionsofleadership.com. Welcome back to Expressions of Leadership. I'm Michele Kawamoto Perry, and today we're in conversation with David Silverstein, strategist, healthcare reform advocate, and founder and CEO of Amaze Health, whose work spans military service, management consulting, policy reform, and building patient-centered healthcare solutions. David, you've said that in your organization, you talk about values and test whether people are adhering to those guiding principles. Why is that so important?
You heard it many times, right? Culture, 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 culture. Over 20 years working with hundreds of different companies out there, I can tell you that there are not that many companies that really take culture seriously. It's a platitude. It's a vision statement on the wall and a mission statement on the wall. But people just get churned, right? They're just there to do a job. There's a small number of companies where culture really matters. You go to a cutthroat New York City law firm, financial services firm. They can be great companies and very profitable, but it's not because of their culture, right? It's for other reasons. Every company has its advantage, its personality. For Amaze, even myself, Amaze is the most culture-driven company I've ever worked with or been a part of myself. And a lot of it really is giving our medical providers, our mental health providers, our team of patient advocates an opportunity to do what they trained to do what they've always wanted to do. One of the terms you've been hearing a lot for quite a few years, really reached a fever pitch during COVID, was provider burnout. But I don't think most people understand what provider burnout actually means. I think to people who don't work in a hospital system, don't work in a super busy urban urgent care, I think they believe provider burnout just means they're working too much, right? 12-hour shifts, it's grueling. But that's not there's a lot of people in this world who work long, hard hours, manual labor. Provider burnout is really more about frustration with the system, right? It's the medical provider in a really busy urgent care who's seeing another patient every 7 minutes and is referring people to an emergency room because they just don't really have time to dig into their problem. And after a while, people start to say, this is not what I trained to do. This is not what I want to do. And so, Amaze is a place where, I hear it all the time. This is where we get to actually do what we trained to do, why we went into medicine in the first place, or why we went into healthcare in the first place. The relationships with patients, between patient and provider, are really serious, genuine relationships. So, creating relationships, real connections with patients, creating a place where really good medical providers want to come work. I mean, we get the best of the best. We have our pick. I have people ask me all the time, some of my investors, well, how are you going to grow the company, right? Nobody can find medical providers. And my answer is, we have our pick. We have an almost unlimited stream of applicants from all over the country who want to work for us because they've heard Amaze is a place where they actually get to do what they train to do. It's the best quality of life. It's the best relationship with their patients. It's the most collaborative, team-based environment. So uh, this company, more so than any company I've ever worked with, is is a is all about the culture.
What about your own personal values? How do those show up in the way that you lead today?
Well, I sort of did it to myself and created a reputation for being all about transparency. So I think, being really transparent, and maybe that also, comes out in me feeling a need to explain things to people and why we're doing things the way we're doing, not just what we're doing and what I need them to do, but, really understanding uh, the why. Um, but in business, I think all of the hard questions come down to two things. It comes down to people and money. And those things are really often at odds with each other. And again, you have to be transparent. You got to have a really honest conversation with people that we are running a business. We're not a charity. I wish we could be a charity, but we're not, because nobody's donating their money to Amaze so that I can pay everybody. So we still have to run a good business and figure out how to take really great care of people at the same time. And that often means there are hard decisions to make. What do you do in a for-profit business if a patient stops paying you, right? What do you do? Um, do you say, I'm sorry, we can't fill that next prescription for you? Meanwhile, they lost their job. They're in a miserable place, right? Their employer's not paying us for them anymore. But if you just say, well, no problem, we'll just take care of you and we won't charge you, well, that's going to bankrupt the company, right? Because that word's going to get out, right? So what do you do? This came up recently, and I said to somebody, I said, listen, if you think you need to, keep taking care of your patient, you know, then do that. You don't leave a patient out there um, without a partner. And I said, but that's not a policy. So, so somehow there's this, tension that you've got to constantly grapple with. You want to do the right things, but you also have to do the right things, or you're not going to be around to do the right thing anymore. And that's it's a constant challenge. Being a for-profit business means we make profit, we get to redeploy that, we get to grow, we get to take care of more people, but we got to make a profit, or we can't do any of that.
We're going to take one final break. And when we return, we'll talk about David's vision for the future of healthcare and the legacy he hopes to leave. We'd love for you to be a part of the Expressions of Leadership community. Follow us wherever you get your podcasts and connect with us on Instagram and YouTube at Expressions of Leadership. You're listening to Expressions of Leadership. I'm Michele Kawamoto Perry, and today's guest is David Silverstein, founder and CEO of Amaze Health. Now, David, when you look at the future of healthcare, what changes do you most hope to see in the next decade?
Wow. I think we're about to go through a decade of total chaos. But that aside, what I'd like to see happen is um, I think we have the foundation of having the best healthcare system in the world. When I hear from people about how they have better systems in other countries, it just doesn't really compute. There are some things that might be better, and then there's some things that people would hate if they moved to that country. I hear about the free healthcare system in Canada all the time. Um, the employees who have worked for me in the past who lived in Canada would get their medical care when they come to the US. People buy private insurance in Canada. So, yeah, there's this government system, but it's not what people think. And so here in the US, you can get that MRI done tomorrow and you can get it done pretty inexpensively. If you go somewhere, you pay cash and all. We have the foundation of the best healthcare system in the world. We have the best medical technologies. We have the best drug discovery process. We have all the right foundations. We have the wrong economic model. So we hear all the time about transactional medicine as though that's a four-letter word, right? Transactional medicine, fee for service is bad. It has its place. A lot of medicine should be transactional. A colonoscopy is a transaction. An MRI is a transaction. So we actually need transactional. And then we need somebody we have a relationship with. And the system we have today has confused those two things. So I'm looking to divide the American healthcare system on a completely different line than it's divided on today. We all need a trusted, independent health and medical partner, which is really what we call primary care today, right? Primary care physicians today don't do what they used to because our systems become so broken. When a hospital buys up a primary care practice, you know why they do it? It's not because they want to be in the primary care business, right? Primary care has got the lowest margins of any part of the healthcare system. So why does a hospital buy up a primary care practice? Well, they buy up a primary care practice because the primary care physician is the one who refers you to the orthopedist. The orthopedist is the one who sends you to the hospital imaging center. And when he gets the imaging back, that's where who does the surgery, right? So it's a feeder system. We need independence. You need a trusted, independent voice. And so I think in 2026, like I said, in the next decade, so by 2036, all of that trusted, independent care can be handled 99.9% virtually. I mean, technology is coming at an incredible pace. There is now, for less than $1,000, you can buy an ultrasound device that connects to your phone via USB, right? The technology is coming so incredibly fast. At-home lab tests, digital stethoscopes. We already make a digital stethoscope that's super high quality and live streams. So the technology is coming incredibly fast. So we can give people this trusted, independent partner and then have a local transactional medical system that does what it needs to do and does best. And then the last thing, we have to completely change this concept of health insurance. It's not insurance when you're buying it from one year to the next. We need to be buying medical insurance like we buy a life insurance, right? On a long-term plan, right? We can't say, oh, you've been diagnosed with something this year. And so next year, because of your diagnosis this year, we're going to drive your employer's costs up by $300,000 to pay the, well, then you didn't have insurance, right? It wasn't that, it's just a payment plan. So we need to change the economics. We need to change the delivery model. I think economics actually comes first because then the private sector will figure out the most efficient delivery model.
And when people look back at your career, what legacy do you hope that you've left as a leader?
I think it's really the empathy, the understanding, the respecting people's intellect and their need to understand what they're doing, why they're doing it, and to feel good about it. I think that to me is what's most important if I'm just looking through that leadership lens.
And for listeners who want to learn more about you or your work, where should they go?
Let's see. Join me on LinkedIn. I think I've got a really easy LinkedIn address. I think it's D Silverstein. So I got one of the early ones. I hope I have that right. Amaze's website is amazehealth.com. And then I write a lot about the healthcare system itself and what's going on there, without talking about Amaze. Just I want Americans to understand the healthcare system and how it really works and what's really going on. And that's at brokenhealthcare.com.
And now it's time for our wisdom and whimsy segment of the show, where I get to ask the guest one advice question and one fun question. So let's start with the advice question. What is one piece of leadership advice that you find yourself giving again and again?
If you want to go fast, slow down. Really, really tear into the problem. I mean, we're all very action oriented and we want to get things done, but we live in a really complicated world. Really dig deep and really, really understand the problem you're trying to solve. Go a little bit slower and you're going to find things going much, much faster. And, yeah, I hear myself saying that to people all the time.
And now for the fun question. I understand that you enjoy playing tennis. If you could play doubles with any tennis legend, past or present, who would you choose as your partner and why?
Probably Rafael Nadal or Carlos Alcaraz. I think those Spaniards just look like they're having more fun out on the court than anybody else. And so it must be something cultural. So I think I would definitely play with one of the Spaniards.
Well, David, thank you so much for being here and for sharing your leadership journey with us, and also for reminding us that changing systems begins with clarity of values and also the courage to act on them.
Thanks for having me.
And to our listeners, if this conversation resonated with you, please share this episode and follow Expressions of Leadership on Instagram, YouTube, LinkedIn, and Facebook. You can also listen to the show every Saturday and Sunday on Radio Evolve Santa Barbara at radioevolve.rocks. This is Expressions of Leadership. I'm Michele Kawamoto Perry, inviting you to lead with clarity, curiosity, and the courage to do the right thing, even when the system around you is complex. If you haven't done so already, make sure to click on that follow button so you don't miss out on future episodes. Have a guest you'd like us to interview? Questions, ideas, or just want to say hello? You can reach us at letstalk@expressionsofleadership.com or connect with us on Instagram or YouTube. We'd love to hear from you. And as always, thanks to our amazing team behind the scenes for making this podcast possible, including our sound engineer, Graham Palmer, and my chief encourager and advisor, Jeremiah Higgins.